which provides not only lifestyle management counseling but also nutrition and exercise counseling. Each patient at Avicenna is almost required or encouraged to see the preventive healthcare team member after seeing the physician on each visit. Data from the Avicenna research unit showed that the majority of patients calling in would not have sought healthcare or would have shown up at the emergency department at Carl or Provena if they were not seen by Avicenna team. Dear friends, compassion is the glue which holds members of a community and societies together. When it goes away, everything falls apart. Therefore, in fall 2008, the local Muslim community formally launched the Avicenna at the local Central Mosque Islamic Center to address these healthcare disparities in our community. Avicenna is not for profit, and which has quickly evolved into an interfaith entity and an academia-community partnership, providing culturally competent, high-quality preventive and curative healthcare to Ghana and Shore residents in Champaign County. The Champaign County Christian Health Center, including the now closed Hope Clinic, had been providing free healthcare services since 2003. Not only were they instrumental in our school's speedy launch in January 2009 by offering to share space, they also provided valuable insights, all examples of interfaith harmony. For us all, the bottom line is to provide smooth, across clinics, high quality healthcare regardless of one's faith or motivation. Avicenna is primarily run on the financial support of its founders and other community members. Since its inception, Avicenna has provided more than 1,200 patients with free healthcare services valued approximately $100,000 or more. Avicenna is not only providing valuable healthcare in a unique setting, but also is helping train the next generation healthcare workforce. Avicenna is managed by UFI faculty and local engineers, management experts and physicians, while student volunteers run its operations. Until now, we have had 3 batches of interns go through Avicenna. We practice medicine in non-traditional ways, where one cannot write big-ticket prescriptions and or labs, where a physician and a nutritionist have offices right next to each other and the patient is treated as a whole. As we know, as you know, there is always an underlying physiological, psychological, social, economic, and or environmental cause for a physical ailment. At Avicenna, you would see College of Engineering students working hand in glove with physicians and nutritionists, and with students from colleges of medicine, applied health sciences, business, law, education, and Parkland College on evaluation and deployment of biomedical technologies such as electronic medical records and developing mobile apps, while concurrently addressing issues of privacy and HIPAA compliance. Envisioning the use of mobile health technology for individualized medicine, of leveraging broadband for creating health information exchange network and patient portals and kiosks, business, law, marketing and advertising majors, developing strategic partnerships and new media, working with accomplished community leaders. Fortunately, Avicenna is a place where all of this is happening now. I mentioned the non-traditional ways of practicing medicine. What I meant by that is that Avicenna healthcare providers take the time to examine their patient. Leveraging the power of hand, the power of touch accompanies standard treatments. This touch creates a physician-patient relationship very essential in healing and recovery. The patients are greeted by volunteers. The volunteers take the time to read books to the children coming with their parents. In the end, I would like to acknowledge friends and supporters in the audience, organizations like CEMEC, YMCA, the First Mennonite Church, Illinois Disciples Foundation, the Carl and Provena Clinics, and the University of Illinois Administration and various colleges for providing unflinching support in pursuing a social entrepreneurial endeavor of this magnitude. I would also like to recognize some of our Avicenna community members in the audience today, Dr. Shaneem Sadiq sitting there at the back, There is our medical director and one of the initial founding members of the Rasina Community Health Center. We have Benjamin Muller, our director of patient operations, sitting here, another Rasina member, and several others who may be present or may be listening. Thanks to all of them. Thanks to all our donors and supporters. Big thank you to the Rasina team. Thank you all for your time and support. Working together in academia community partnership, we can be the instrument of change.
I think the most important thing, and the reason that we wanted to do our presentations together, is the choices that people have to make between healthcare and food. I would say of the close to 60,000 people who have come through Wesley Evening Food Pantry in the last 6.5 years, the number one thing that I hear that is the emergency or crisis that causes them to need to seek food is there's been a health crisis in their family. That is the number one reason. So I'm going to see if I can get my pictures to go on while we're talking. And again, I hope you'll still listen and not get too distracted by the pictures. So as you've already heard, Wesley Evening Food Pantry is open once a month on the third Thursday of the month in the evening for people who are in families where the households are working. Many of you, I see many volunteers here in the audience today, so you've already heard this story, but I'm going to tell it for the rest of you. I did not make it my life's mission to find something that I needed to do to save the world. I was a regular person, and in fact a data person, not a social service person. And I was having dinner with a friend of mine who works for Eastern Illinois Food Bank, and we were talking about data and surveys and the aggravation of getting data out of a system if you didn't design it. And she happened to mention how many people in Champaign County are in families where the adults are working, but they cannot meet their own basic needs consistently. And I don't remember what that number was 6.5 years ago. I think right now that number would seem trivial. At the present time, estimates in Champaign County are that nearly half of the residents in Champaign County at some point in the course of a year need emergency help of some kind. But when we started 6.5 years ago, the numbers still seem large to me. And we're still not talking about doing anything, but she happens to mention that, well, for those people who are in households that are working, there are no food pantries in Champaign County at that time that had regular evening or weekend hours. So people that need help, they have to take time off of work to get the assistance. And that really bothered me. And so I said, not thinking that I'm going to do anything about this, I said, how often would a food pantry need to be open? You know, I'm thinking every day, every week. And she said, if there was a food pantry that was open once a month, in the evening, with, you know, hours that people could count on, that would make a difference. And so, the next week, I went to a small group that I was part of at Wesley, and I told people about this need and how there was, you know, a solution that could make a difference that involved once a month after work. And there were 3 of us that said, how hard could that be? We could do that. And I hear the laughing back here because we know how hard that can be now. So 6.5 years later, we are still open only once a month for 2.5 hours on the third Thursday of the month. And last night was the third Thursday of April.